my slides. The first thing I thought I might quickly show everyone out of interest would be everyone can obviously see that we've got a very exciting collection of tweets going on behind us. And there are actually tools to measure that, and they measure the optimum rather than the actual practical. But I sort of just did this myself on my laptop. So if you put the hashtag of today into one of these tools, the tweets that have been sent out by around about 20 people have reached a potential number of over 12,000 people. And that can sum up to over 45,000 impressions. And that's just the last 50 tweets of the 250 that have been so far. And I ran a conference recently about young people creating change in their communities. And we had about 100 people attending, and over 2 days I think we had 95,000 people and about 480,000 impressions over a 2-day period. So it does really have that ability. I'll set this back now. But yeah, so I thought I'd briefly talk about where you can actually be involved, because Lee sort of talked about the concept of patients and a bit about public health and how it can sort of incorporate with your traditional media activities, as well as sort of building on community wisdom. And we're still a very long way behind in Australia, a really, really long way behind. And I think certainly the Mayo Clinic is a perfect example of how far behind we are. And possibly it is this whole issue with policy and buy-in, and the health sector's very risk-averse, and oh dear, what would happen if someone said something bad about our hospital system? But I think we kind of have to try and make our benefits work beyond this sort of bureaucratic model. So I've got a few suggestions as to how and where you can actually personally get involved. And the general answer is starting with you. You know, sure, your hospital system isn't necessarily going to magically say, yeah, we're going to get on the Twitters and the YouTubes and everything else. They're not going to do that immediately overnight. But you, on the other hand, can do that. And so something that hasn't really been mentioned a lot in detail is the actual concept of professional development through social media. And it can actually be a way to connect health professionals together, and actually a very surprising way, through stuff like blogs, through finding out the news, and through creating, I guess, a mix of traditional ways of finding the news in healthcare, and also new ways. And certainly, coming from the medical student perspective, I've managed to sell this onto my flatmate, who is not a Twitterer and not a huge social media aficionado, but he now follows about 10 or 15 blogs, and like me, in a clinical environment, you can sort of start talking about, oh, you know, some patient with atherosclerosis, and you can say, oh, did you hear about that article that was in the Lancet recently? And all that's happened is you've actually just read about 4 sentences, but you sound really smart. And you sound really up to date. And it really is fantastic to be able to see people doing that. And perhaps the best Australian example is Life in the Fast Lane. And Life in the Fast Lane is a blog created by some emergency physicians over in Perth. And it's now one of the, I'd say it probably is the largest emergency medicine blog in the world. And they do posts very, very frequently, really frequently, about all kinds of things, about toxicology, about interesting cases, you know, what is the problem with this Zulu man's little toe? And there's pictures and there's interactivity, and they've also got resources on there. They've got an ECG library, which is fantastic from a student's point of view as well. And they're really, really successful in being able to actually provide this information and being able to allow the emergency medicine community to stay up to date in a way that's fun, it's quick, there's no embargoed things that take 10 years to come out and you don't have to wait for the reviewers to look through everything. And in the same way, when a new article does come out in emergency medicine, they're able to put up a post about it. And so rather than everyone having to read this 10-page long article, there's a paragraph and they can say, you know what, this is how that might actually relate to my practice. And there might be as an intensivist, there might be as an emergency physician, might be as a general practitioner. And they're able to look at that and say, I'm going to read that article in detail. So it does certainly provide that opportunity. The second one I wanted to talk about was this whole concept of the circle of health. And if you've got to sort of consider the experience of someone who's seeking healthcare. And there's 3 main dimensions. And the dimensions are you as the provider of the health, or alternatively as the healthcare system, or however you might be involved. There's obviously the patient, but then also there's the family and friends. And how do we sort of let everyone actually have their say? How do we let everyone be able to actually provide the feedback as to how the experience is going? How the experience is going from a patient's perspective? How the family is feeling that the experience is affecting them. Because we know that there's a lot of research about the way in which healthcare systems actually implicate the coping mechanisms and the ability of providing good experiences to family and friends. It's not just beyond the patient. And the interesting thing with all of this is that people are already talking about you on social media. I sat down with Carolyn not so long ago, and I pulled up a copy of Radiant 6, and I said, "Oh, let's have a look at who's been mentioning Liverpool Hospital." And lo and behold, there's tweets about Liverpool Hospital, there's blog posts about Liverpool Hospital, there's blog posts about Royal North Shore Hospital, and there are all of these people, and it's patients checking into the hospital, it's actual people at the hospital who are working there checking in every morning, which I think is an interesting thing from a hospital's administrative perspective. And also, there's people saying things like, "Oh, coming to see mum. Oh, she's not looking too good today." And that's an opportunity from a hospital's point of view and from a healthcare provider's point of view of being able to actually provide that support. And that might be being able to tweet back and say, "Hey, sorry to hear that. We've got a parent support group that runs every Thursday. If you'd like more details, let us know." Or it might just be saying, "Really sorry to hear that." Because people are already talking about you. They're talking about your hospital, they're talking about your clinic, they're talking about your practice, they're talking about your professionalism, and from a sort of public health perspective, they're talking about your campaign. And you need to actually be able to pull that feedback in because it's a really valuable research source. One of the things that I do is sort of advise about social media in the youth sector. So the youth sector has also been pretty slow to take up social media, considering that you sort of have this mix between young people who love social media and youth workers who are generally a hell of a lot older and sort of don't really know what Facebook is other than an annoying thing that young people do and sit there rather than actually talking to them. But one of the things that the youth sector is slowly starting to discover is the benefit of social media as an actual research tool. People don't like to fill out young people particularly, don't like to fill out your really long 15-minute survey. But if you say, "Hey, like this page," and you ask them a question every now and then, if they think that question's important, they're going to respond to it. And you can collate those responses, and that is an easy way to create research. And I know it's not necessarily absolutely fantastically, statistically, wonderfully amazing research. All right, I've done enough statistics as a medical student to know that offers all sorts of problems as far as recruitment and all that sort of thing. But it certainly is one way for you to be able to get research and be able to find out those answers and be able to look at them on a wider level. So that, I think, is all I wanted to say. Yep, that's all I wanted to say. So now we've got a forum to have a chat about any more ideas.